Hi, I'm Judd Fisher, Ball Brothers Foundation's president, and we've been doing a series of videos on leadership in the Muncie and Delaware County area. And during this video, you'll be able to see several of our leaders from healthcare organizations that span a wide area of our state. And they have some very good things to say, some interesting things. And we'll be able to tell you about how hard they're working and their employees are working and trying to make sure that our communities are safe, healthy, and fighting COVID-19 together. Thank you.
I'm Hank Milius. I'm President and CEO of Meridian Health Services. Meridian is an integrated healthcare system. We offer some acute psychiatric care. We also offer a plethora of behavioral health services and primary care services. Meridian Health has literally changed overnight in many different ways, and much of it for the good. To give you one example, in terms of our behavioral health services, last year, April 2019, we had about 900 telehealth visits. April 2020, and we're not even done with April 2020 yet, over 20,000 telehealth visits. We have 6 full-time psychiatrists prior to COVID. We have 6 full-time psychiatrists located in Indianapolis doing nothing but telemedicine. I'm sure that will increase now because we're just now becoming more acclimated, accustomed to it. Regulations have laxed a little bit to allow us to spread that a little bit further. Primary care. Last year, April, we had 1 telehealth visit. 1. This year, this month, not over almost 1,000. It's just changing overnight. Healthcare workers are right there in the trenches. Obviously, we're in the trenches too, but we're trained for this. We, for the most part, have the equipment and the wherewithal to handle this. We understand it. It's just simply changing overnight. I walked into my office today and had an aha moment. I have been connected with my executive staff every single day during this crisis. Every single day. Yet I have not seen them for 30 days. We are totally physically apart. I could have an executive staff member in Alaska and I wouldn't know it. We will prevail. This too shall pass. It's the character of our country. It's the character of our community. But it brings out the best in people. People really do come together.
I'm Brian Ayers. I'm the CEO of Open Door Health Services. The first thing we did was made the principled decision not to lose any staff. So we're going to continue to pay them. We've moved about 60 of our employees off-site to work off-site as best they can. We've reverted to telehealth. About 50% of our visits are now done virtually. We're busy with protective equipment for staff, patients, anybody who needs it. We've worked well with a lot of the community organizations to make sure if we have extra supplies, we're able to share them. The testing process is still a little bit of a mess. We use LabCorp, we use the state lab, and when appropriate, we're using the IU Health system. But we've tested 70-some individuals thus far, including some staff, and all of our staff have come back negative, which is great. And I think we've tested maybe half a dozen or more patients that have come back positive. The physical distancing is huge. We've all talked about flattening the curve. I think we've done that. Our trick now is to maintain that. The most recent reports and modeling I've seen is if we can maintain our distancing for the next 2 weeks, we can decrease the possibility of a resurge of this pandemic by 25%. We're all itching to get out the door and to meet and greet and be with our loved ones and our friends and family. We need to do that cautiously. Face masks are not just important, they're for some a matter of life and death. For those that can't not be with people, making sure you're maintaining the minimal contact and cleaning up after yourselves and others is essential to everybody's health. We're going to get through this. We've already gotten through the worst part of it, and the more patient we can be, the more understanding we can be, I think the better we'll all be in the long haul. There are a lot of resources throughout the community for people who are feeling extra stressed because of this. We've posted a lot on our website. The hospital has a lot up on theirs. United Way, Community Foundation, everybody's got information posted for resources for those that are feeling a little extra anxious or stressed.
My name is Jeff Bird. I'm a physician by formal education, and I'm blessed to serve as the president of IU Health Ball Hospital in the IU Health East Central region. So ultimately, I have responsibility for IU Health Ball, IU Health J Hospital, and IU Health Blackford Hospital. This is certainly the most unique healthcare situation that I've ever been involved in 35 years of practicing medicine and being a healthcare leader. To think last fall when we were busy every day like we always are, and how we operated as a healthcare entity and as a hospital, and the difference in how our day-to-day operations work now in the pandemic, it's really fascinating for me to see and to watch and to see how our team has adopted. And by our team, I don't just mean my hospital team. I mean our outpatients, our affiliated healthcare entities that we work with, how we've rallied together to really recognize that we're all in this together. You know, though the sickest patients are in my facility today and have been for the last 6 weeks, we couldn't do it without the coordinated efforts and the collaboration of everyone in the community, not just the healthcare people, but all of the other people in the community that have been so incredibly supportive of what it is we're trying to do. We know that during the pandemic, the most important thing that we can do as a community is to support each other, and to support each other and keep each other safe means doing what's been in the popular press. Right? You have to be able to shelter at home, and you have to be able to self-isolate, and you have to be able to protect yourself, because as you're protecting yourself, you're protecting everyone else also. So that's the key to the term flattening the curve as we move forward around not overwhelming my hospital and my hospital responsibilities. We got predictions 8 weeks ago and 4 weeks ago about where we would be today, and we are in a much better place today than the predictions told us we would be, and that's because the community's rallied around doing the right thing. And without that, we've planned for the worst case scenario, and I am so very thankful that as hard as it's been nowhere near the worst that it could have been. I share your fear. Right? You know, I've got parents in their 80s who have chronic medical diseases, and it's been hard for me not to go over and give them a hug. The challenge around what we've had to do and how we've had to work through this, to understand first and foremost that you have the healthcare treatment here, the ability to, if you do get sick, know that you are going to get the best outcome that you could ever hope for in Muncie and in East Central Indiana. And so I'm very proud of that. It's a trying time, and the end is not in sight. In East Central Indiana, in Muncie and Delaware County, I'm prepping for always having COVID patients in my hospital for the foreseeable future. And for that, I mean not weeks, not months, but very likely years, because I'm not sure this is ever really truly going to completely go away. We're going to learn from it, and we are going to be better as we work through the journey that we're on. I think we're going to start, even in my entity, early May, we have a plan to begin to get back to some semblance of normal and what that's going to mean. Our outpatient offices, who have drastically changed the way that they've operated, will begin to get some people back in there that we wouldn't have wanted in the office a month ago or 6 weeks ago. So we think slowly but surely we're going to start opening back up to those things over the next 4 to 6 to 8 weeks. And so I'm very excited about being able to have our team and our community feel like, hey, you know, we're getting there. And I'm confident that's going to happen.
Well, thank you for listening to what several of our healthcare leaders in this community and beyond are doing for everyone as we fight against the pandemic together. And I just want to remind you a few things. in our Ball Brothers Foundation world, we still would like to make sure that folks are calling us, emailing us to talk about the potential for grants and some grantees that need some information. We are working from home, but we are monitoring our email, our phone, and we're doing video conferences and other things to make sure that we're communicating with all the nonprofits and partners in this community who need to talk to us. Thank you. Stay safe, stay healthy, be well. Thanks.